Vibrio vulnificus infection. This terrifying infection can turn a simple swim in the ocean or a raw oyster meal into a brutal, flesh-destroying medical emergency. Vibrio vulnificus is a marine bacterium that thrives in warm saltwater, particularly in the Gulf of Mexico and southeastern coastal regions of the United States. It causes flesh-eating infections when it enters through cuts or wounds exposed to seawater. Eating contaminated seafood like raw oysters can also introduce the bacteria into the blood. Once inside the body, it produces toxins that damage blood vessels and rapidly kill surrounding tissue. Symptoms include rapidly spreading pain followed by fever and confusion. Healthy people may only develop mild symptoms like vomiting or diarrhea, but in those with weakened immune systems or chronic liver disease, the bacteria can rapidly invade the bloodstream, causing serious harm in hours. Treatment demands antibiotics and emergency surgery. Amputation is common in severe cases. In July 2025, a Florida outbreak killed 4 people and hospitalized several others after swimming or fishing in contaminated waters, reigniting public concern about this deadly pathogen's growing reach in warming seas. Hemorrhagic smallpox. Few diseases have destroyed flesh so gruesomely or on such a global scale as hemorrhagic smallpox. In its most severe form, this viral infection caused blackened skin, widespread bleeding, and the literal sloughing off of flesh from the body. Caused by the variola virus, smallpox spread through inhalation of airborne particles during close human contact. While the typical form produced high fever and a pustular rash, the hemorrhagic variant resulted in widespread blood vessel damage and internal bleeding. Blood flooded into the skin, mucosa, and organs, turning skin purple-black as it died. Ulcers formed in the mouth and throat, and skin could detach in sheets. Mortality approached 100%. Though eradicated in 1980 through vaccination, smallpox once devastated civilizations. Entire indigenous populations in the Americas were decimated after European contact. Today, the virus exists only in 2 maximum security labs, where it is kept under tight surveillance due to its catastrophic potential if ever reintroduced. Naegleria fowleri. Also known as brain-eating amoeba, Naegleria fowleri destroys brain tissue with astonishing speed, killing nearly all who are infected. This microscopic amoeba lives in warm freshwater environments such as lakes, hot springs, and poorly maintained swimming pools. Infection occurs when contaminated water forcefully enters the nose, typically during swimming, diving, or other water sports. From there, the amoeba travels up the olfactory nerve directly into the brain, where it causes primary amoebic meningoencephalitis, an infection that obliterates brain tissue. Drinking the water does not cause infection. Symptoms begin within 1 to 9 days: sudden headache, fever, nausea, and seizures, followed by hallucinations and coma. Death typically occurs within 5 to 7 days. Fewer than 10 cases occur in the U.S. annually, but the mortality rate exceeds 97%. Outbreaks have been linked to warm weather water activities. In rare instances, early diagnosis and aggressive treatment have led to survival, but most cases end fatally within a week. Leprosy. The lepromatous form of leprosy kills flesh not through infection alone, but by silencing pain, allowing unnoticed injuries to fester, decay, and disfigure over time. Mycobacterium leprae causes this chronic disease, which attacks the skin, mucous membranes, and especially peripheral nerves. Transmission is slow and occurs through prolonged contact, usually via respiratory droplets. In parts of the Americas, contact with armadillos is a confirmed source. Most people exposed never develop disease due to natural immunity. In the lepromatous form, bacteria multiply unchecked in the skin and nerves, leading to widespread numbness and thickened nodular lesions. Patients lose the ability to feel pain in affected limbs, leading to repeated injuries, chronic ulceration, secondary infections, and the gradual death of digits. This can result in autoamputation of fingers, toes, or nose. Facial thickening and collapse of the nasal bridge produce the characteristic leonine facies. Leprosy remains endemic in regions of India, Brazil, and Africa. Historically, isolation in leper communities reflected society's fear of its flesh-destroying outcomes. Necrotizing fasciitis. This disease is horrifying because it rapidly devours living flesh, often turning a minor skin wound into a body-wide emergency. Necrotizing fasciitis attacks the connective tissue beneath the skin, and sometimes the muscle layer. As the infection progresses, it destroys tissue so quickly that large areas may liquefy in hours. The cause is usually bacteria, with group A Streptococcus being most common. Other culprits include Staphylococcus aureus and E. coli. These microbes release toxins that cut off blood supply and suppress the immune system's response. Infection typically begins when bacteria enter through a break in the skin. Even trivial cuts, insect bites, or burns can be enough. Symptoms start with severe pain, followed by swelling, fever, blisters, and tissue death. Treatment includes intravenous antibiotics, surgery to remove dead tissue, and sometimes amputation. The media have reported several public cases, including outbreaks linked to contaminated water or acupuncture, which underscores how unexpectedly this deadly infection can strike. Pyoderma gangrenosum. Unlike infectious causes of flesh destruction, Pyoderma gangrenosum is an autoimmune condition that causes the body to attack its own skin, leading to deep, painful ulcers that resemble aggressive infections. Despite being non-contagious, its rapid tissue breakdown and disfiguring potential place it among the most disturbing flesh-destroying diseases. The ulcers often begin as small, red bumps or pustules and rapidly expand into crater-like wounds with undermined edges and purplish borders. Even minor skin trauma, like a needle prick or scratch, can trigger an exaggerated immune response known as pathergy, worsening the condition. This reaction can lead to massive skin loss, particularly on the legs, arms, or trunk. Because it mimics bacterial infections, misdiagnosis is common. However, antibiotics offer no benefit unless secondary infection occurs. The primary treatment is high-dose immunosuppressants like corticosteroids or biologics. Pyoderma gangrenosum is strongly associated with diseases like ulcerative colitis, Crohn's disease, and rheumatoid arthritis, making it part of broader systemic autoimmune dysfunction. Mucormycosis. Mucormycosis is terrifying because it kills flesh by invading blood vessels, cutting off circulation and leaving behind patches of black, rotting tissue. This rare fungal infection is caused by molds like Rhizopus, Mucor, and Lictimia, which live in soil and decaying organic matter. When spores are inhaled or enter open wounds, especially in people with weakened immune systems, the fungi spread rapidly. The most common route of infection is through breathing in spores, which can lead to sinus, facial, and brain involvement. The fungus can also enter through traumatic injuries or contaminated wounds. Once inside, it penetrates blood vessels, clots circulation, and causes tissue to die. Black necrosis often appears around the eyes, nose, or wound sites. Patients may require disfiguring surgery to remove infected flesh or bone with high-dose antifungal medications. In 2011, a tornado in Joplin, Missouri led to 13 cases of wound mucormycosis, causing 5 people to die. During the COVID-19 pandemic in India, thousands were affected due to widespread steroid use. Fournier's gangrene. This form of flesh-eating disease is particularly horrifying because it targets the genitals, perineum, and lower abdominal wall, causing rapid destruction of soft tissue in one of the body's most sensitive regions. Fournier's gangrene spreads with alarming speed and often leads to massive tissue loss, permanent disfigurement, or death. It is caused by a combination of bacteria that invade through minor skin breaches, boils, insect bites, or surgical wounds near the groin. High-risk individuals include those with diabetes, obesity, alcoholism, immune suppression, or urinary infections. Symptoms begin with intense pain, redness, and swelling, followed by blackened, dying skin and foul-smelling discharge. Gas-producing bacteria can cause crepitus, a crackling sensation under the skin. Without emergency surgical removal of dead tissue, sepsis and multi-organ failure often follow. Pemphigus vulgaris. This autoimmune disorder devastates the skin in a way that mimics flesh-eating disease, causing layers to peel away, leaving raw, exposed tissue beneath. Pemphigus vulgaris occurs when the body produces antibodies against desmogleins, proteins that keep skin cells anchored together. The result is acantholysis. Cells separate, and the skin detaches in fragile sheets. Blisters often begin in the mouth or on mucous membranes, then spread to the face, chest, and limbs. These blisters rupture easily, leading to widespread wounds that resemble second-degree burns. Patients may suffer severe pain, fluid loss, infection, and even septic shock if untreated. Triggers include certain medications or genetic predisposition, though many cases arise spontaneously. Once uniformly fatal, pemphigus vulgaris is now treated with high-dose steroids and long-term immunosuppressants. Despite modern therapy, relapses are frequent and management can extend over years. It remains exceptionally rare, affecting between 1 and 10 people per million annually. Brown recluse spider and other venoms. Venomous bites from animals like the brown recluse spider are horrifying because they can liquefy flesh in a matter of days, turning a pinpoint wound into a spreading necrotic ulcer. The Loxosceles reclusa spider delivers a cytotoxic venom that destroys blood vessels and tissue at the bite site through enzyme-mediated cell death. The bite is often painless at first, with symptoms emerging hours later as redness, swelling, and blistering. Within days, tissue breaks down, forming a deep ulcer with a gray or black center of dead skin. In some cases, skin sloughs off entirely, exposing muscle or fat. These wounds are prone to secondary bacterial infections, including by resistant organisms like Staphylococcus aureus, complicating treatment and healing. Other animals, certain vipers, scorpions, and marine creatures, can produce similar injuries that cause widespread cell death. These are toxin-induced injuries, requiring wound care, antivenom when available, and sometimes surgical debridement. Antibiotics alone are ineffective unless infection sets in,